Hi, I'm Dr. Dean. I'm an eye surgeon working in Nelspruit, Wombela, and today I want to talk briefly about macular hole surgery. So essentially, macular holes, like other retinal conditions, require a PPV or postpartum vitrectomy to repair them, and they can only be repaired or fixed surgically. There's no medical treatment really for a macular hole. A quick reminder what a macular hole is. It's a hole in the macula. If you want to see one of my other videos, I go into a bit more detail on that, but just a reminder, your macula is in the center of your retina, and instead of looking normal like this, you can develop a hole. That hole can look a variety of ways, but there's a good example of a hole there or over there. So to repair macular holes, we do a PPV, we remove the gel, and we do what we call an ILM peel. ILM stands for internal limiting membrane. The ILM is a thin membrane on the surface of the retina, on the very, very top. If you look at an OCT scan, which is a cross-section cut through the retina, you can see there's 10 layers of the retina. Right on the surface, right on the top here, is a very thin little membrane called the ILM. And we know that by doing a vitrectomy and peeling that layer of ILM with the addition of a gas tamponade, we can get the macular hole to close with a high rate of success. So this is a normal OCT, so this is a patient without a macular hole with the ILM intact. An OCT of a macular hole would look like this. You can very clearly, easily see that there's a gap where the retina has split on the surface. To be able to peel the ILM, we use special dyes. There's a variety of dyes and stains that are used. They can be green, they can be blue. Essentially, we inject a blue dye onto the surface of the retina for a couple of seconds and then remove it. And that stains the ILM a blue color, allowing us to see it and to pick it up and to peel it off. To see what that looks like, here's some examples. So here you can see the ILM has been stained with a blue dye, and this is a microforceps, and you can see that the internal limiting membrane is being peeled around that macular hole. Here's another example of a circumferential peel of the ILM, which is off the back of the retina. Sometimes patients may also have an epiretinal membrane associated with it, and that ILM is peeled off the back of the retina. It's a very satisfying looking procedure to do. Once we have completed the ILM peel, we will inject a gas bubble into the eye, and we'll fill the eye with gas. We don't normally use normal air. We use specialized gases like SF6, C2F6 or C3F8. These gases stay in the eye for a longer period of time, and we use these as tamponades for that gas to push up against the macular hole and allow that hole to close. For the first week to 10 days, we recommend face down positioning. The reason for that is your macular hole is at the back of your eye, and by positioning your head face down, the air bubble pushes up against the back of the eye and allows that hole to close. Here's just an example of a gas bubble in the eye with the patient looking down, and this is where the macular hole is, and this encourages that hole to close. So that is the purpose of face down positioning. Although it's a challenge, it's difficult to keep looking down. To try and increase closure rates or to get that macular hole to close, we encourage this because it does increase the rate and the chances of the macular hole closing. In macular hole surgery in general, we will almost always use a gas tamponade. So it's really important to know that if you have gas in your eye, you cannot travel to altitude and you cannot get into an airplane or be in environments where there's a change in atmospheric pressure, because gas is subject to that pressure. It can expand or contract or shrink depending on the altitude. Also, it's really important to understand that you cannot travel with gas in your eye until your doctor tells you it's safe to travel. But that's the basics of macular hole surgery. It's a vitrectomy, an ILM peel where we peel the internal limiting membrane with the help of a stain, and then we insert gas into the eye as a tamponade and recommend face down positioning to allow that hole to close, and very importantly, not to travel or fly with gas in the eye. I hope that was helpful and interesting. If you need any more information, please feel free to contact us.